it's Jessica DaMassa with WTF Health. With me right now, I have Tim. He is a consultant from Egon Zehnder. So Tim, before we start, for everybody watching, what is Egon Zehnder? What do you guys do?
We're a leadership advisory company, so we advise companies of all industries on leadership topics.
Okay, this is important in healthcare right now. So, as far as healthcare is concerned, what is your advice for somebody in healthcare in terms of digital leadership? What do we need to do to kind of push forward and lead the way into this uncharted territory of digital health?
I think I'm just out of a great session actually with a lot of motivated and enthusiastic representatives of the healthcare industry and talking about the successes they already have achieved. So I think we have come a long way already in healthcare. But still, there are industries who have progressed a little bit further in establishing digital models for their customers to make lives better and easier. So healthcare can learn on how to exactly better the user experience for these customers they have and bring them on a level that they're already enjoying in many different parts of their lives.
Okay, that you make it sound very simple, which I think is probably part of your job as a consultant. But to talk me through the painful reality of what that takes. So it sounds like you're talking about tech companies or maybe financial companies that have integrated a digital platform and are working digitally, and now we're trying to replicate, build our own digital models in healthcare. What do we need to do? Because it's painful in healthcare.
It is, and there are specifics in the regulation and also in the people who sit between the provider and the patient. And so you have to take everyone along. So it's a high degree of complexity involved. Still, there are some common patterns also with the other industries, and especially around the concept of leadership and how that is changing now in the new age. From a place where you can tell everyone what to do and how the world looks like and looking for confirming evidence of how the world looks like, to a place where you empower people of finding the realities themselves, setting the context, but having them operate in a significant degree of autonomy towards reaching their goals. And this is also what we look for as Egon Zehnder when we talk to leaders. How much are they progressing in that direction of empowering the organization, of finding the best solution even without being told where to go?
How much of this has to do with millennials? In addition to a more tech-enabled workforce, but I mean, that's been, I feel like, especially with leadership, as people get older and they get promoted into leadership positions and the new crop comes in, how much of this has to do with that?
And this is the good news. I mean, the millennials, they want this.
Good.
They want this style of leadership, and they demand it, and they get frustrated by someone limiting their degree of freedom and autonomy, talking in general terms. So there's a demand on both sides, both with regard to how do I best build the businesses and to the people who are actually building the business and what they want in their daily work environment.
What's your best advice for a healthcare leader that wants to adapt a more progressive approach to leading their organization?
There was a great quote just now from the audience who said that really good leaders ask great questions and therefore get better answers. So, and this for me was a perfect summary I would bring of what makes great leaders going forward.
That's fantastic. I like that. I'm going to borrow that. Hopefully I'm asking good questions, good leadership on this show. Thank you so much for joining us, Tim. It's a pleasure to talk to you and pick your brain. Thank you. I'm Jessica DaMassa with WTF Health. Thank you for joining us.